If you're noticing vertical lines above the upper lip and looking for an effective treatment option, this video is for you. People call these smoker lines, but in reality, you don't have to be a smoker to develop these. It's one of the most common aging concerns that affects my patients and many people out in the community. And they're frustrating, rightfully, because they can become difficult to treat. But the good news is you have options. Hi, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon with over 20 years experience helping patients look as young as they feel. Let's get right into it. First, I'll need to define a few things. The area above the upper lip is called the white lip. Below that region is called the red lip. The border between those two areas is defined by the vermilion border. This region is important because the skin here is actually relatively thick compared to many other parts of the face. This affects which treatments work best. As we age, several things are happening simultaneously in this area. We start to lose collagen and elastin, which are major structural proteins that give skin that thickness and that responsiveness and resilience and elasticity. As you begin to lose these things, the skin becomes more susceptible to lines and wrinkles. We also lose some of the underlying support and fat around the mouth. The subcutaneous layer is that layer just below the skin. And when you lose that fat, the skin becomes also more susceptible to folding on itself because the whole region becomes a little thinner. Now, at the same time, the orbicularis muscle, which is a ring-like muscle that surrounds the mouth, continues contracting literally every day. Every time you purse your lips, you take a sip of water, you drink through a straw, you speak, you kiss, or make any type of facial expression, that orbicularis muscle is contracting. And the contraction moves the skin of the white lip in a direction that leads to vertical lines. So keep in mind, every time muscles in the face contract, whether they're around your eyes or whether they're around your mouth or in the smile line, every time the skin contracts, wrinkles begin to form, and the mouth is no different. So a muscle repeatedly folding aging skin eventually creates a wrinkle. Now, in the beginning, these are referred to as dynamic lines. Somebody who's in their 20s and 30s, when they raise their forehead or when they squint, you're going to see lines forming in those areas, but immediately the line goes away. So in that phase, it's a dynamic line, but when you're not contracting the muscle, there's no line there. But over time, as collagen and elastin continue to diminish, those temporary folds eventually become permanent static lines. Once the static line forms, the wrinkle is there when your face is completely relaxed. This is really, at the end of the day, what you're trying to prevent, the evolution from a dynamic line to a static line. And that's really the foundation of what people use Botox for all around the upper face. As the upper lip ages further and also becomes thinner and longer, which makes the lines appear even deeper, that continuum is how the upper lip lines evolve. That's how it goes from a dynamic to a static line. Now, understanding this is critical because the treatments change depending on where you are on that spectrum and that evolutionary process. So let's start getting into the early stages and the treatment of the dynamic lines. So if you're lucky enough to be watching this video in your 30s and 40s and you haven't evolved to a place where you have a dynamic line that has transitioned to a static line, right? So in other words, when your mouth is relaxed, you don't have any lines there. But when you do start expressing, you start to see the lines. When this happens, it is an easy thing to prevent the evolution. You do it by injecting a little bit of Botox in that region of the upper lip. This is a specific area where more Botox is definitely not better. When they put too much Botox in this area, the smile flattens, you weaken the lip movement, it makes it very difficult to purse your lips, and it even creates an unnatural look that patients absolutely hate. But it doesn't have to be that way. My wife Netta, for example, the muscles around her mouth were very strong. And for years, we've been placing a small amount of Botox, literally 1 or 2 units on each side of the upper lip, just to soften the expression of that muscle, weaken it just enough to where it doesn't form those dynamic expression lines. So even though she's 54 now, she doesn't have any deep lines in that area, But guarantee you, if we weren't treating this region the way we did, by now she would have had some very deep lines in that region. This approach works extremely well preventatively, but it is not necessarily the best treatment if those lines have already become etched into your skin permanently when your mouth isn't expressing. This is a very important thing to keep in mind as you're planning on what type of treatment to do. If you don't have any lines at rest, but you do have them when you express, this is where I would start with a little bit of Botox. What do you do once the lines are present, even at rest, where you are now dealing with a static wrinkle? So at this stage, a very small amount of filler into those upper lip lines can actually help quite a bit. There's a very important technical caveat. When I was treating patients with filler, I would use a very, very thin filler because this area can't take a lot of thickness in that region. Because the skin folds inward and it forms basically a groove, if you try to fill the line vertically, meaning you stick the needle underneath the line and you inject some filler, a little bit of filler can go on either side of the line. And when that happens, you end up creating a mound that actually makes the line appear deeper. So when that happens, you've made the situation worse. When I was injecting, when somebody had a very, very minimal amount of lines in this area, I would actually go horizontally to the line and little threads of filler, basically parallel to the direction of the lip, inject tiny little bits of filler across the line. So that way you're not creating mounds on either side. And then maybe in a very, very direct way, injecting perpendicular to the skin, just over the line, just to give a little bit of push into the dermis of the skin. If you have a good injector, they probably have their own tricks. But something to keep in mind is that if you have a deeper line and you repetitively inject this area, especially if you go vertically, what you are going to potentially see is a wavy appearance to the upper lip that over time can appear very unnatural and unfortunately can be very, very permanent. I've had a tough time addressing these when they have already formed, and they make it very difficult for patients to remedy this, even if you try to remove some of the filler. Because remember the evolution of a filler, once it's injected into the skin, there's a fibrosis that occurs, a scar tissue formation. And if you end up with this, very difficult to treat, even if later on you do laser resurfacing. So keep in mind, small amounts of filler in this area used once or twice can probably be safe to add a little bit of volume. Doing it vertically and doing it too often to try to fill these lines, you're going to hit a point of no return and you're going to be stuck with some very unusual looks to this region, which is something I definitely think you want to try to avoid specifically in this area. So we learned that dynamic lines can be improved with Botox. We learned that very mild static lines can be improved with a little bit of filler. Now, what do you do when you have moderate or severe lines? In my opinion, the single most effective and rewarding treatment for these lines is resurfacing. You could do a deep chemical peel like a phenol peel or a deep TCA peel. You could also do a mechanical dermabrasion. You can also do laser resurfacing. And that's the one we're going to concentrate on right now because that's probably the most, I would say, safe and effective approach that you can take with these upper lip lines and the most precise. The concept behind resurfacing, no matter whether it's chemical, mechanical, or laser, is pretty simple. You're basically taking the skin down to the base of the wrinkle. If you're looking at it on cross-section, if you take away the top half of the skin, well, guess what? The wrinkle disappears. As long as the wrinkle folding is shallow enough to where you can remove the skin above it, you're fine. If you go below a specific layer in the skin will not heal and you'll end up with scar tissue. That's a problem. So you have to be very precise about how deep you go with this. And that's why I personally prefer the Erbium Yag laser resurfacing because it gives you precision and you know exactly how deep you're going. The other aspect of it is when you use, for example, a CO2 laser or mechanical microdermabrasion and even a deep phenol peel, the healing process is so long and so arduous that the post-inflammatory phase can lead to hypopigmentation. Hypopigmentation is when you basically damage all the melanocytes in the skin and you can't form any more pigment and the skin becomes white. And when skin becomes white, you end up looking like you have a milk mustache. This is a major reason why personally I began to search for an option that was going to be safer. And what I came up with is the Erbium Yag laser. The nice thing about Erbium Yag is that it's very precise and it's a cool laser, so it doesn't create a lot of heat. And even if you want to go deeper and try to get to the sweet spot of the skin to remove as much of the line as possible, your healing is going to be pretty minimal. So you're typically going to heal within about 2 to 3 weeks from a laser like this. And because there's a shorter inflammatory phase, there's also a less likely chance of forming hypopigmentation. But with any type of resurfacing, in general, the earlier you treat the lines and the more shallow the lines are, the more likely you are to fully correct them. We see these lines and sometimes they're just simply too deep. Even if we resurface them, we're only going to make them better. We're not going to make them go away. So if you can get to them earlier, you can actually get rid of them completely. Everything I'm talking about here is fully ablative. Deep chemical peel, mechanical dermabrasion, the CO2 and the erbium laser that I'm referring to treats the entire surface of the skin and actually removes part of it. That is, by definition, ablative. There's another category of laser that doesn't treat the entire surface of the skin, and that's referred to as fractional. So fractional lasers are things like Fractional, Halo, Fractional, and these work by treating literally a fraction of the skin surface at a time. So anywhere from 10 to 20% of the skin is receiving a column of laser light or energy that's deployed into the skin. This leaves the rest of the surrounding skin effectively untreated. So what I've found is, though these technologies have absolute value in various applications, they're not very useful or powerful and reliable when it comes to treating moderate or severe upper lip lines. Keep in mind, for deeper etched wrinkles, you're not going to get the result of a full field resurfacing because you're not actually sanding the tissue down. You're not actually removing layer after layer of skin that gets down to the bottom of it, right? So that's important. Now, I'm not saying these are dangerous or even completely useless. You are definitely going to be building some collagen as a response to this and maybe a little bit of skin tightening, but I'm just saying keep some expectations very realistic so that you don't end up feeling let down. Now, there's another category of treatments that are basically either non-ablative or energy devices. These are things like IPL, vascular lasers, radiofrequency, microneedling, things like Morpheus 8, and other similar technologies. These may absolutely improve the skin quality modestly, but they are generally not going to meaningfully erase deeper vertical upper lip lines. So if you're thinking about some of this stuff, you might want to think twice. I haven't seen real results from these treatments, and there's a reason for it because you're not removing anything. Again, you're just improving quality of skin, and the cat's out of the bag once those lines have deeply formed. Many people often ask me whether a lip lift can help the upper lip lines. So there's an interesting nuance here. I do think that it can help, but only indirectly. In other words, when you're doing a laser resurfacing, you're working directly on the problem itself. You're sanding down the actual line that exists. But because a lip lift shortens the white lip and effectively adds structure and support to the area, because remember, you're removing a strip of skin and you're closing that skin, but you have the same amount of fat and muscle and actual lip volume in the white lip. So you're kind of stuffing the bag, if you will. And that oftentimes can indirectly push some of those lines out and just give the lip a little bit more integrity. So I've noticed that when you do that, it can soften some of those wrinkles. So I would never tell a person, hey, let's do a lip lift to improve your upper lip lines. But I do think it is a pleasant side effect of a lip lift that you will see some level of improvement to the upper lip lines. It's more of a potential secondary benefit when a lip lift is indicated for the right reasons, which is to create balance and proportion to the upper lip, along with other procedures like, say, facelift or vertical restore, etc. So if I were sitting with you in a consultation, this is how I would think about upper lip lines. Your best preventative tools are a small amount of Botox, careful preservation of skin quality, good skincare, sun protection, possibly subtle structural support with a little bit of filler, and fat transfer early. And just keep in mind, the reason why the line forms is not because your lips are moving. Your lips have always moved. It's because there's a change in the quality of the skin as a result of loss of collagen and elasticity. So focus first and foremost on keeping and improving the integrity of the skin by using the right actives like retinols and vitamin C and all those things that we talk about in many of our videos. Once the lines have become moderate or severe, resurfacing becomes the most definitive treatment option. It's a once and for all type of a procedure. Sand it down, you get to the base of it. Moving forward, you focus on your skin and keep the tissues in good shape, maybe do a little bit of Botox, etc. That area will stay looking great from there. So it's a great reset. And that's really important. In my hands, Erbium Yag resurfacing has consistently been the most effective and safest approach. I would also strongly caution against overfilling and repeating filler injections in this region because of that long-term distortion that can become extremely difficult to correct. And ultimately, some mechanical things like not using a straw as your primary way of taking in liquids can actually make a difference because that gesture of putting your mouth around a straw puts a lot of stress on the orbicularis muscle. And that's really the source of where this whole thing came from. I mean, we ubiquitously see this in people who are chronic smokers. In addition to the fact that they're mechanically pursing their lips around a small straw, smoking is also a rapid accelerator of skin aging. So you're kind of giving a 1-2 punch there. But that's where the term smoker lines came from because you see it in all smokers. Keep in mind that this is my opinions, but it's a perspective that comes from literally 2 to 3 decades of treating patients. So I hope all of this helps you navigate the steps that it would take to prevent and avoid and treat upper lip lines. All right, folks, that's it. So if you enjoy videos like this, where I break down facial aging and give you the science behind it, make sure you subscribe to this channel. And if you think this is valuable information, make sure you share it with a friend or family that needs to hear it as well. And if you want to get a little bit more in-depth information about content like this, make sure you sign up for our free Karam MD newsletter. And if you have had some experiences with some of these treatments, make sure you drop it in the comments below. We're a community here. We want to learn from each other and share it from each other's experiences. All right, folks, until next time, Dr. Amir Karam.